Medical nanotechnology, revolutionizing drug delivery. In recent years, the field of medical nanotechnology has emerged as a promising approach to revolutionize drug delivery. Nanoparticles, tiny structures at the nanoscale, have shown tremendous potential in enhancing the efficacy, specificity, and safety of drug delivery systems. By exploiting the unique properties of nanoparticles, medical scientists are able to design targeted drug delivery systems, enabling the delivery of therapeutic agents to specific sites within the body. In this comprehensive guide, we will explore various aspects of medical nanotechnology, including targeted drug delivery, passive and active targeting strategies, controlled drug release, multifunctional nanoparticles, Theranostic nanomedicine, liposomal formulations, polymeric nanoparticles, solid lipid nanoparticles, gold nanoparticles, carbon nanotubes, and magnetic nanoparticles. Join us as we delve into the fascinating world of medical nanotechnology and uncover the future of medicine. Targeted drug delivery is a revolutionary concept in the field of medicine, aiming to enhance the specificity and efficacy of therapeutic agents while minimizing their side effects. The use of nanoparticles as carriers for targeted drug delivery offers several advantages. Firstly, nanoparticles can improve the stability and bioavailability of drugs, ensuring their efficient delivery to the target site. Moreover, their small size and ability to penetrate cellular barriers enable the delivery of drugs to specific cells or tissues, optimizing their therapeutic effect. Additionally, the surface properties of nanoparticles can be modified to achieve active targeting, where ligands or antibodies are attached to the nanoparticle surface, allowing specific interactions with target cells. The development of targeted drug delivery systems holds immense potential in treating diseases such as cancer, cardiovascular disorders, and neurodegenerative diseases. Passive targeting strategies exploit the unique physiological characteristics of diseased tissues to enhance drug accumulation and retention at the target site. The enhanced permeability and retention (EPR) effect is a crucial phenomenon utilized in passive targeting. Nanoparticles, due to their small size and prolonged circulation time, can extravasate through the leaky vasculature of tumor tissues and accumulate within the tumor interstitium. This phenomenon allows for the preferential accumulation of nanoparticles within tumors, enabling efficient drug delivery and reducing systemic toxicity. Passive targeting strategies have shown great promise in the treatment of solid tumors, enabling the delivery of high concentrations of therapeutics while minimizing exposure to healthy tissues. Active targeting strategies involve the use of ligands or antibodies attached to the nanoparticle surface to achieve selective interactions with target cells. These ligands can recognize specific receptors or markers overexpressed on the surface of diseased cells, facilitating targeted drug delivery. Active targeting can enhance the specificity and efficacy of drug delivery, allowing for efficient treatment of diseases with high target cell heterogeneity. By conjugating targeting moieties to nanoparticles, medical scientists can achieve precise drug delivery to specific cells or tissue types. Active targeting approaches hold immense potential in the treatment of various diseases, including cancer, HIV, and infectious diseases. Controlled drug release systems offer the advantage of sustained drug release, allowing for prolonged therapeutic effects and reducing the frequency of drug administration. Nanoparticles can be designed to encapsulate drugs and release them in a controlled manner, either through diffusion or by responding to stimuli such as pH, temperature, or enzymes. By modulating the nanoparticle formulation, researchers can achieve tailored release kinetics, optimizing the therapeutic window. Controlled drug release systems have the potential to improve patient compliance, minimize side effects, and enhance the therapeutic efficacy of drugs. Multifunctional nanoparticles combine multiple properties and functionalities to enhance drug delivery and therapy. These nanoparticles can simultaneously carry therapeutic agents, imaging agents, and targeting moieties within a single formulation. Through the integration of different components, multifunctional nanoparticles enable simultaneous imaging, diagnosis, and treatment of diseases. For example, by incorporating fluorescent dyes or contrast agents, these nanoparticles can enable real-time visualization of drug delivery and monitor therapeutic responses. Multifunctional nanoparticles represent a promising approach towards personalized medicine and can revolutionize the diagnosis and treatment of various diseases. Theranostic nanomedicine embodies the integration of diagnostics and therapeutics into a single nanosystem. These multifunctional nanoparticles combine therapeutic agents, imaging agents, and diagnostic tools to enable targeted therapy and simultaneous monitoring of treatment responses. By incorporating diagnostic capabilities, Theranostic nanoparticles can provide real-time feedback on treatment efficacy, facilitating personalized medicine approaches. The development of Theranostic nanomedicine holds great promise in precision medicine, allowing for early disease detection, accurate treatment monitoring, and improved patient outcomes. Liposomal formulations are lipid-based nanoparticles that have been extensively studied for drug delivery applications. These nanoparticles consist of a lipid bilayer structure encapsulating drug molecules within, providing protection and controlled release. Liposomal formulations offer several advantages, including high drug loading capacity, biocompatibility, and the ability to encapsulate hydrophilic and hydrophobic drugs. They can also be modified to exhibit prolonged circulation time and enhanced targeting capabilities. Liposomal formulations have been successfully utilized for the delivery of chemotherapeutic agents, vaccines, and gene therapies, demonstrating their potential in various clinical applications. Polymeric nanoparticles are composed of biodegradable polymers that can encapsulate and deliver a variety of therapeutic agents. These nanoparticles are highly customizable, allowing for facile modification of their physicochemical properties and surface characteristics. Polymeric nanoparticles offer advantages such as controlled release, tunable drug loading capacity, and reduced toxicity. Additionally, their ability to encapsulate a wide range of drugs, including small molecules, proteins, and nucleic acids, makes them suitable for various therapeutic applications. Polymeric nanoparticles have shown promise in cancer therapy, antimicrobial treatments, and regenerative medicine, paving the way for innovative drug delivery approaches. Solid lipid nanoparticles, SLNs, are lipid-based nanocarriers that offer advantages over traditional drug delivery systems. These nanoparticles consist of a solid lipid core surrounded by a biocompatible surfactant layer. SLNs have shown improved drug stability, enhanced drug loading capacity, and efficient drug release profiles. They can also be surface modified to facilitate active targeting and achieve sustained drug release. SLNs have found applications in various therapeutic areas, including cancer treatment, dermatology, and ocular drug delivery. The development of SLNs holds great promise in overcoming challenges associated with conventional drug delivery systems. Gold nanoparticles, OMPs, have gained significant attention in nanomedicine due to their unique optical, electronic, and thermal properties. OMPs can be easily functionalized and conjugated with drugs, imaging agents, or targeting moieties, enabling versatile applications in drug delivery and theranostics. The localized surface plasmon resonance of OMPs can be exploited for photothermal therapy, where the nanoparticles absorb light and convert it into heat to ablate tumor cells. Additionally, the large surface area of OMPs allows for high drug loading capacity and efficient delivery to target sites, making them promising candidates for cancer therapy and imaging applications. Carbon nanotubes, CNTs, are cylindrical carbon structures with unique mechanical, electrical, and optical properties. These nanomaterials have shown great potential in drug delivery, imaging, and biosensing applications. CNTs can be functionalized with drugs, targeting moieties, or diagnostic agents, allowing for targeted drug delivery and simultaneous imaging. Their high aspect ratio and large surface area enable efficient drug loading and release. Furthermore, CNTs can serve as nanocarriers for gene therapy, delivering nucleic acids to target cells. Although the translation of CNTs into clinical practice requires further research, their versatility and unique properties make them promising candidates for future biomedical applications. Magnetic nanoparticles, MNPs, have emerged as a powerful tool in medical nanotechnology, enabling targeted drug delivery, magnetic resonance imaging, MRI, and hyperthermia-based therapy. MNPs can be functionalized with therapeutic agents, imaging agents, and targeting moieties to achieve site-specific drug delivery and imaging. Magnetic targeting utilizes an external magnetic field to guide MNPs to the target site, improving drug accumulation and reducing systemic toxicity. Moreover, MNPs can generate localized heat when exposed to an alternating magnetic field, allowing for heat-mediated cancer therapy. Magnetic nanoparticles offer great potential in personalized medicine, providing theranostic capabilities for precise diagnosis and treatment. Medical nanotechnology has ushered in a new era of drug delivery, offering unprecedented opportunities for targeted, controlled, and personalized therapy. Through the development of various nanoparticles, scientists are enhancing drug delivery systems to achieve better treatment outcomes while reducing side effects. Targeted drug delivery approaches, both passive and active, offer enhanced drug accumulation at the target site, optimizing therapeutic efficacy. Controlled drug release systems enable sustained drug release, prolonging the therapeutic effect and reducing dosing frequency. The integration of multifunctional and theranostic nanoparticles provides simultaneous imaging, diagnosis, and treatment capabilities, paving the way for personalized medicine. As we continue to explore the vast potential of medical nanotechnology, we are poised to witness transformative advancements in drug delivery and revolutionize the way we approach disease treatment.